So, some people that view my channel might be somewhat familiar with the dude Julius Evola, or the author, well, he's an author also, he was a prolific author, or Savitra Devi, okay? So if psychiatry is the poison that's causing an influx of gender dysphoria, or one of the many poisons, what's the antidote? Well, the antidote is traditional interventions with a modern twist, orthomolecular twist, orthomolecular treatments. So, medical yoga therapy. What the hell is it? Medical yoga is defined as the use of yoga practices for the prevention and treatment of medical conditions. Beyond the physical elements of yoga, which are important and effective for strengthening the body, medical yoga also incorporates breathing techniques, mindfulness. Now, what people don't understand, these are all physical things. Yoga, as a science, and it is a science, and as a practice, as I would say, the physical therapy of Ayurveda, is very much a physical thing. So what people don't understand, breathing techniques, mindfulness, meditation, these cause very real changes in the neurotransmitters. They cause very real changes to how the endocrine system is working, etc. When you combine these things with a sattvic type diet, it doesn't have to be a totally sattvic diet, but it should definitely, a sattvic diet, in case people don't know, is the diet outlined in the Bhagavad Gita and other such texts, and is encouraged to be eaten by the Brahmin caste of India. So it's a vegetarian diet that makes use of no fermented foods, no unusually spicy foods, and no garlic, no pungent foods like garlic or onions. It doesn't have to be totally sattvic, because garlic and onions and hot peppers and these things, these are very healthy foods. So it doesn't have to be totally sattvic. I would recommend at least a whole food, plant-centered, omnivorous diet, if not a totally plant-centered, 100% plant-based Adventist diet. So, what is this? What is this medical yoga? Well, within the past decade, yoga has infiltrated not only Western culture, but also Western medicine. Okay, it's infiltrated. I love that wording. Was this written? This had to be written by an American. Yeah, Hillary McClafferty. Yeah, yoga has infiltrated the West. Yeah, it's been in the West for a couple hundred years now. Just pointing that out. And it's also infiltrated medicine a couple hundred years ago. Okay, this isn't actually a new thing. It's finally being adopted by mainstream physicians. The more we learn about this ancient practice, the more we realize that its benefits go far beyond increased flexibility and muscle tone. A common misunderstanding is that yoga predominantly focuses on increasing flexibility. It also increases strength. This is what I think is funny. So, when you practice yoga, it increases your strength, it increases your flexibility, it increases your coordination, and it increases your VO max too. Your ability to utilize oxygen. So, people this shows the ignorance of physicians to the benefits of exercise, honestly. Hatha yoga, traditional hatha yoga, just plain hatha yoga, is going to help the whole system of the body. But hatha yoga is only the beginning. It's the beginning to Raja yoga. But modern medicine has made enormous progress in controlling communicable disease over the past century, such that it is now the non-communicable diseases that have reached epidemic values, or epidemic levels. The World Health Organization estimates that 80% of non-communicable disease deaths are due to the four main disease types: cardiovascular, cancer, diabetes, and respiratory diseases. Unfortunately, lifestyle is the causative factor in most of these things, okay? Including tobacco use, a sedentary lifestyle, lack of exercise, unhealthy diets, and chronic psychosocial stress. Chronic inflammation and stress is a common factor of many of the non-communicable diseases, and an area where yoga has been found to be extremely beneficial. Recent research has shown that yogic and mindfulness-based practices can positively impact the body in many ways, including helping to regulate blood glucose levels and keeping the cardiovascular system healthy. It also has been shown to have important psychosocial benefits, as the practice of yoga can help increase alertness and positive feelings and decrease negative feelings of aggressiveness, depression, and anxiety. Some healthcare providers are responding to these positive findings, as well as the growing patient demand for an alternative. See, this is the thing. Calling yoga an alternative approach is idiotic. If anything, some of these more allopathic methods should be seen as an alternative to the more traditional methods such as yoga. Yoga is, even if it is pure hatha yoga, it is essentially physical therapy. Okay? Prescription yoga. Medical yoga is defined as the use of yoga practices for the prevention and potential treatment of medical conditions beyond the physical elements of yoga, which blah, 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 we already went through this. Medical yoga therapy ideally is an individualized, personalized, and holistic approach that takes into account not only the patient's mind, body, and spirit, but also their family, support network, work situation. So basically, it's the biopsychosocial model, which has been incorporated into everything anyway. So, as an example, if one is diagnosed with anxiety, a physician trained in medical yoga may prescribe specific breathing techniques, pranayamas, calming postures, asanas, mindfulness-based practices, and or meditation. This type of therapy does not incur the potentially adverse effects of medications and can produce benefits to the patient long after their relationship with the health provider ends. Another benefit of yoga is it is gentle enough that you are not going to incur there's not much of a risk of incurring damage to the organism when you're practicing yoga. So, in other words, it helps to build strength, builds flexibility, build coordination, build mental alertness, these things, without, like other forms of exercise, without the risk of damaging yourself. The mindfulness and meditation aspects of yoga are ways of training the mind so that one is not distracted and caught up in its endless churning thought stream. These practices build resilience, help the patient cope with stress, and manage potential triggers for anxiety. They can also promote self-reflection that may uncover the sources of one's anxiety. If necessary, anti-anxiety medications and or psychotherapy may be used in tandem with medical yoga. In such cases, is strongly adjunctive and complementary. Yoga is most powerful when it changes the patient's general health outlook, changing the emphasis from reactive to proactive health management. The yogic definition of health, or svatha, is when the functions of the body and mind are in harmony, so that they can turn inward. So this would be kind of like the Japanese concept of aki. Okay, in yogic terms, when you are really yourself, meaning when you have recognized that the Atman has been the Brahman all the time, you are truly at ease. It is the loss of the self that creates dis-ease. This is a bit different than the Western concept of health, which is often defined as the absence of disease. I would not state that optimal health is characterized as the absence of disease. I think that that is a common misconception. I don't think that Maybe doctors might off the cuff say that, but I do think that most medical practitioners that are honest know that optimal health is more than simply the absence of disease. There are certain aspects that are required to consider somebody being in optimal health. Accordingly, this way of thinking reaffirms the understanding that nature, in other words, health is health. The absence of disease is simply not being sick. So what is yoga? Yoga is not a particular denomination or religion, but an age-old practice based on a harmonizing system of the body, mind, and spirit to attain inner peace and liberation. Yoga is a tool that can deepen and benefit anyone of any religion. It does not conflict with personal beliefs. It is simply a vehicle to help one transform oneself by promoting conscious connection with oneself, the world, and the highest truth. The highest truth being Brahman, or God. There are many traditional paths of yoga, including Tantra, Mantra, Kundalini, Bhakti, Jnana, Karma, Raja Yoga, and others. Now, what you have to understand is a lot of these are simply aspects of, for example, Mantra Yoga is simply chanting. Karma Yoga is simply right action. Okay, so according to the classic text of the Yoga Sutras of Patanjali, yoga is the complete inhibition of the modifications of the mind, or quieting the constant chatter in one's mind so that our true selves can manifest, rest in our own true nature, and be free of suffering, disease, as described in the sutras. It is said to be an impediment to spiritual practice. Growth and freedom from suffering. Traditional yogic practices include breath control and techniques, pranayama. So this is what you have to understand here. So it's going to include all of the following. These are also present in physical therapy. So it's going to include breath control techniques, or pranayama, meditation, including mindfulness. Well, that's not necessary. That's more so in psychotherapy. But the adoption of specific bodily postures, or asanas, that's the stretching you see done, and self-reflection, scriptural or self-study. As a mindfulness practice, yoga requires one to be fully aware in the present moment. This practice helps to diffuse anxiety and sadness. All the yogic practices use present moment non-judgmental awareness as the foundation of course. Such presence benefits the healthcare provider as such as the patient. If one can learn to pay attention to oneself, one can really pay attention to one's patients. One can then teach the patient to pay attention to him or herself. Medical yoga prescription. Medical yoga, as considered here, comprises the use of traditional yogic practices to prevent, cure, and/or ameliorate disease. The ideal medical yoga prescription includes the yogic practices of breathing techniques, bodily postures, meditation techniques, and self-reflection. A healthy, nourishing diet, reducing substances such as caffeine, tobacco, drugs, and alcohol, healthy sleep hygiene, and appropriate support, which may include family. So it's basically the 8 laws of health, which we've gone over before. But the specific exercises of yoga are what's important. So for providers considering adding yoga to their therapeutic armamentarium, whatever, that's an unnecessarily large word that I don't know the meaning of, that I'll have to look up after I do this video. The best place to start is to consider yoga therapy as a complement to their patient's current medical treatment. Yoga brings the autonomic nervous system into healthy balance by stimulating the parasympathetic nervous system. The sympathetic nervous system, or our emergency response system, is activated when our body or mind feels threatened or perceives being stressed. Okay, whether blah, 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 yada, da, da. Many in today's society live in a sympathetic overdrive. This occurs when the body perceives, now this is what's known as autonomic dysfunction, when autonomic. It's the autonomic nervous system is actually the life support system. Okay, so what happens is your autonomic nervous system starts to overreact to everything because of, and there's a gentleman by the name of Gabor Mate. He's a Hungarian gentleman that was born during the Second World War. I recommend people learn about him. The body becomes desensitized to stress hormones. It's what some people call adrenal insufficiency or adrenal fatigue. It actually is real. It's just autonomic dysfunction is what it is. Due to the continued excitation, one of the major neuroendocrine systems of the body, the hypothalamic pituitary adrenal axis, is set in motion. The HPA axis regulates and helps to control many different bodily processes, including one's reaction to stress, immune function, digestion, and energy expenditure and storage. This axis is set in motion with the release of corticotropin releasing factor from the hypothalamus. CRF then stimulates the anterior pituitary gland to release adrenocorticotropic hormone, ACTH, which subsequently stimulates the adrenal cortex to produce and release cortisol. In response to the stress, cortisol functions by adding in the metabolism of fat, protein, and carbohydrates by converting them to glucose through gluconeogenesis. This longer-term stress response subsequently raises blood glucose levels, suppresses the immune system, and causes the retention of sodium and water by the kidneys, with subsequent increased blood volume and blood pressure. At a certain blood concentration, cortisol will exert a negative feedback to the hypothalamus. Not all stress has unfavorable effects, of course. Now, this is, again, what we call hormesis. Hormesis, you need little stresses to adapt to them. But so many people are overly stressed is the problem. Chronic stress is bad, okay? So what happens is when stress becomes negative, when it exceeds one's ability to cope, at this point the body systems can become fatigued, causing multiple problems both physically and emotionally. Chronic stress is experienced when there is a mismatch between the perceived demand and one's ability to cope with that demand. It includes one's emotional and mental response to the outside situation. When one is continually stressed, whether that stress is real or perceived, his or her nerve... Now, this is the problem. A lot of us today are dealing with first world problems. What do I mean by that? We're dealing with stress from work, from school, from deadlines, from things like that, from not having the car we want or the house we want or the life we want, things of that nature. And that's also where logotherapy would come in and things like that. But what you need to understand is these are perceived stresses. These are not stresses that affect your biological organism, but they do, because they are perceived to be life-threatening threats. And in some ways, they are. Okay? If you do not meet a certain standard of living in today's society, you might not eat. Okay? So that's where it really does become important that we do delve a little deeper into some of the philosophies and ideas of people like Abraham Maslow, and folks like that. So at this point, and biological psychology, stuff like that. But at this point, the actual activity of the sympathetic nervous system decreases with a decline in the release of epinephrine, but corticosteroid release continues to be activated at above normal levels. This is why people get fat. Who remembers, there used to be an over-the-counter medicine called Relacor. And Relacor contained DH. Amongst the many ingredients it contained a hormone, not a very high dose of it. I think it was 25 milligrams of DHEA. Now, DHEA kind of acts as the opposite of cortisone, or of cortisol. So what DHEA did was it helped to decrease belly fat in people that were chronically stressed. A lot of people don't know that's why that worked, but that's why that worked. I think Relicore still exists, but I don't know if it still has the same ingredients. So, in such a case, the individual may no longer even recognize that they are in a stressful state. Moreover, chronic stress can be precipitated by any number of factors and conditions, some regular and unavoidable. Constant worry, daily life. This is what most people end up becoming debilitated from. Constant worry, daily life hassles, frustrations over one's job or family, traffic jams, finances. Poor sleep is probably the biggest. And poor sleep, poor eating habits, and not enough exercise are probably the worst. One of the problems is the human animal evolved in an environment to be moving, to sleep solidly, and to eat whole natural foods. This is not what we are doing. So we are not feeding the body with fresh air, clean water, and whole foods. And we are not moving the body by walking to and from wherever. Okay? By picking things up, by running, by jumping. So there is the human body is not being utilized in the way that it is genetically manufactured to work. So that's why this stuff is going on the way it's going on. Medical yoga, or yoga in general, allows for the body to start to be used in an appropriate way. So stress can even also be triggered by one's memory of difficult or scary past situations. That's like post-traumatic stress. This state of high stress causing continuous sympathetic stimulation is epidemic in our society, from the corporate executive down to the young child on a busy school and activity schedule. So stress is part of our lives. So does it matter? In fact, the burden due to stress-related illness is quite concerning. The Centers for Disease Control and Prevention estimates that stress accounts for about 75% of all physicians' visits and up to 80% of all visits to primary care providers. Research has shown that continued and chronic stress can result in a generalized immunosuppressive effect that prevents the body to initiate a timely and appropriate immune reaction. During acute stress, norepinephrine, epinephrine, and ACTH are released, signaling certain kinds of cells to become mobilized into the bloodstream, potentially preparing the body for fight or flight. Acute stress increases levels of pro-inflammatory cytokines in the bloodstream, whereas inflammation. So if you're already eating an inflammatory diet and you're stressed, you're screwed. Okay? So, chronic stress, like acute stress, is associated with high levels of pro-inflammatory cytokines, but with potentially different health consequences. Type 1 cytokine protective immune responses have been shown to be suppressed during times when the body is undergoing challenges of chronic stress, while pro-inflammatory and type 2 cytokine responses are activated. Chronic or long-term stress can also suppress immunity by decreasing the number of immune cells as well as their function. These phenomena may exacerbate pro-inflammatory diseases and thus potentially increase one's susceptibility to infections and possibly different types of cancers. Chronically high levels of cortisol also are neurotoxic. These high levels have been associated with accelerated aging, cognitive inhibition, impaired memory, and impaired ability to learn. So increased anxiety and fear, as well as depression. Cortisol activates the amygdala, the body's threat center, yada yada yada. So how do yogic practices work? Yoga-based practices of postures and movement sequences are usually taught in conjunction with some type of breathing and or meditation technique. This type of mindful movement with slow rhythmic breathing is more likely to promote a parasympathetic and vagal tone compared to other forms of exercise. Improved vagal tone is reflected by the increased heart rate variability, which is the variation in the time interval between heartbeats, and this physiologic phenomenon can be predictive of how readily the heart rate returns to normal or quiets down after increasing in response to a stressor. Decreased heart rate variability is associated with poor myocardial function, often seen after a myocardial infarction, meaning a heart attack, and is seen with increased sympathetic activity. Increased heart rate variability with high frequency activity is associated with increased parasympathetic activity. Yogic breathing techniques, and the easiest yogic breathing technique is simply the Buddhist method or the yogic method of natural breathing, assuming a comfortable seated position and focusing on the breath. But what they're going through here is the traditional pranayama. Okay, with the right, this is the alternating nostril breathing. Okay. It appears that formal meditation practice can change both brain structure and function. It has been found that people who do more meditation practice develop more robust brain structures in addition certain areas. Multiple studies have shown that yogic practices such as mindful meditation can increase both cortical thickness and gray matter, particularly in areas controlling emotional regulation and executive functioning. Meditation has been shown to increase the thickness of the left hippocampus and the region of the brain that functions in the formation of long-term memory, emotional regulation, and cognition, as well as being a critical area of the brain that plays a vital role in the resiliency to chronic stress and depressive states, possibly due to expression of hippocampal neurotropic protein. Okay. Mindfulness meditation, particularly in long-term expert meditators, has been shown to diminish activity and size in anxiety-related areas of the brain. Recent studies suggested that hatha yoga postures alone can also improve stress and increased relaxation dispositions. This randomized controlled trial performed in 2015 among college students with high psychological stress assessed the effects of sun salutations on relaxation dispositions. Okay. People that don't know what the sun salutation rite is, look it up. So yoga and neurotransmitters. Yoga practices can increase multiple neurotransmitters and hormones such as GABA, serotonin, dopamine, and natural antidepressants, all natural antidepressants. They have been shown to increase levels of melatonin, helping to initiate sleep, improving sleep quality, and sleep regulation. GABA is one of the body's chief inhibitory neurotransmitters, working to reduce neuronal excitability. GABA acts, multiple kinds of both anxiolytic and antidepressant medications work by increasing GABA levels. As mentioned earlier, yoga practices seem to be effective by bringing the parasympathetic and sympathetic nervous systems into balance. Meditation increases activity in the PFC, the prefrontal cortex, as well as stimulates the thalamus, in particular the reticular nucleus, which increases production and delivery of GABA throughout the CNS. Studies have shown that GABAergic inhibitory interneurons result in cortical inhibition, which has been implicated in improved cognitive performance. Yoga and telomeres. This is people that meditate are younger than people that don't meditate. But yoga and meditation, mindfulness practices in yoga have been moving more and more into the mainstream. Telomeres are small. People know what telomeres are if they follow my channel. So, and if you don't, just Google the term telomere. So meditators and yoga practitioners have longer telomeres than people that don't.
In 2008, Dean Ornish found a significant association between comprehensive lifestyle changes, including yoga, meditation, breathing, stress management, and a healthy whole food plant-based diet, and increased telomerase. Meditation has also been shown to be potentially protective regarding RTL, an intriguing study, loving kindness meditation. Yoga and inflammation. Yoga knocks down inflammation by controlling the release of the cytokines. Yoga and back pain and arthritis. Obviously, the exercising aspect and the knocking down of the inflammation is going to help with that. Yoga is very beneficial to cardiac issues. There are a number of challenges, blah, blah, blah. Multiple risk factors are known to cause oxidative stress, leading to the Okay, yoga therapy may be a significant and cost-effective therapy. It's also less stress-inducing than traditional, well, I shouldn't even say traditional exercise. Yoga therapy is not aggressive. Okay, one of the problems with things like running or heavy weightlifting and things like that is you risk damaging yourself. If you damage yourself, you have to take a break from exercise. When you take a break from exercise, you're going to not be able to exercise, and a lot of times people get discouraged from ever going back to exercise. Yoga practices help to lower blood pressure, increase lung capacity, improve respiratory function and heart rate, improve circulation, and boost muscle tone. As previously discussed, yoga can reduce stress, both by balancing the autonomic nervous system with increased parasympathetic yada. An intriguing study by Krishna et al., I don't know who the hell that is, evaluated the effects of yoga therapy in patients with heart failure. Okay, yada, 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 yada. It increased heart rate variability, so it helped to at least partially reverse the issues. And both of these are measures of cardiac and autonomic function. In this trial, 130 heart failure patients randomly assigned to receive either a yoga intervention program or standard medical therapy alone. Heart rate, blood pressure, and measures of cardiac autonomic function were assessed before and after 12-week intervention. The results were quite significant, with p-values. The yoga group compared to the controls, sympathetic nervous system modulation, yada, 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 yada. High frequency increased significantly as well. So the yoga people did better than the non-yoga people. The study suggests that there could be a great benefit of yoga therapy as an adjunct to medical treatment in patients with heart failure. In addition, because it is important to consider that patients with severe and or decompensated heart failure, physical exercise may not be well tolerated. Finally, they're getting to what I was saying. Yoga is particularly gentle. The breathing exercises are particularly gentle. Okay, so in the longevity game, what we have to remember is slow and steady wins the race. Okay, as a complementary and integrative therapy, yoga for the management of hypertension has been studied in numerous randomized controlled trials. On average, the overall effect of yoga therapy results in a reduction of systolic blood pressure of approximately 10 milligrams per blah, yada, 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 yada. Yoga therapy may also be quite useful in a complementary therapy for atrial fibrillation. That's another issue with the electrical function of the heart. Yoga for pediatrics, of course, children need to get moving. It's going to help kids, of course. And it's not as challenging as gymnastics or something like that, nor is it as dangerous. Conclusion: ongoing research into yoga and mindfulness-based practices continues to reveal and uncover health benefits supporting its use in health management. Although there have been many published studies and research trials demonstrating and advocating yoga as treatment and or adjunct therapy for multiple disease entities, there are limitations that should be noted for a number of these studies. Many of these studies are single-center trials, and the practice of yoga is not as easy or as quick as taking medication, but mounting evidence suggests it's worth the effort and investment. Yoga helps one to reconnect with oneself. It can help to uncover why and how one's illness may have started in the first place. So that's what this is. Moving on. So when we come back, we're going to talk about the chakras, which are pronounced as chakras by most people, but it's chakra. And we're going to talk about how they correlate to the endocrine system, the different glands of the endocrine system. Okay. We're going to discuss the 3 treasures or 3 jewels of traditional Chinese medicine. Now, there's actually a 4th one that they're not mentioning here, which is yi. Yi is the mind. It's the consciousness. So they're going to speak about jing, which is virility, qi, which is life force or vitality, and shen, which is spirit or will. Okay? I'm probably going to bring this lovely young lady up again in my next video. I strongly encourage people to follow Dait Darling. Okay? Follow her podcasts, especially the Postmodern Iconoclast. Okay? She is a Thalemite. Okay? That's what she does. She's a Thalemite. But a Thalemite or Thalemite, most people pronounce it Thalemite. She pronounces it Thalemite. But what I want people to understand here is her videos are very diverse, but she deals a lot with gender, a lot with sexuality in relation to the occult and esotericism. And this has a lot to do with reality. People don't want to believe that, but it's the truth. Okay, so I strongly recommend people follow her channel. When did she last do a video? She just did one 11 hours ago. This was, I believe, a podcast that she did. And I would just strongly encourage people to understand the importance of understanding these things. This is why I encourage people to read the works of Aleister Crowley. Aleister Crowley, if one reads Aleister Crowley's books, especially just the basic book, Magic, Book 4, which discusses a lot of the stuff, I can almost promise a person will gain a deeper insight into reality based on the concepts of yoga. He deals with the concepts of yoga and of traditional Western esotericism. And that's all for this video. When we come back, I'm going to cover that other stuff. Okay.